Today, I want to talk about something I see so often as a pharmacist that drives me crazy, and that is nutrient depletion due to chronic medications. I say it drives me crazy because so many people are completely unaware that this occurs. They have no idea that they should be looking out for it. They are not getting their levels checked. Their doctor forgets to tell them about it, forgets to keep an eye on certain key nutrient levels in their body. And I just hate it because it makes people wary of chronic medications. It causes them to have side effects. It makes them quit super important medications like blood pressure and statin medications, for example. And it could be easily prevented or resolved if people were just aware of the nutrients that they need to keep an eye on that can get depleted by taking certain medications. So first up, let's talk about PPIs, or proton pump inhibitors. So many people are taking these medications. A lot of them are warranted. They really require it for something like Barrett's esophagus, for example, but a lot of other people don't realize that they are taking a PPI inappropriately. If you are using an over-the-counter proton pump inhibitor, please know that it's meant to be used for only 2 weeks at a time, and that 2-week course is going to last you between 3 and 6 months. It kind of downregulates your acid producers. It's not required to take every day for most people unless you have a diagnosis that requires it. So you may want to talk with your provider about weaning down or quitting the PPI in the first place. But if you do require a PPI because of your chronic health condition, no worries. We've got you covered. Be on the lookout for these key nutrients that can get depleted because PPIs affect your body's ability to absorb things. Okay, so you're just not going to be getting all of the nutrients out of your food like you would be if you weren't on a PPI. An absolutely key thing that PPIs deplete that we can clearly see in the data is magnesium. Magnesium deficiency can present in a lot of different ways, but some of the most common things that we'll see is increased frequency of headaches, twitching in the legs, uncontrollable twitching around the eye, those muscles, unexplained weakness of the muscles, constipation, leg cramps, and just general fatigue. So if you're experiencing those symptoms and you are taking a PPI, please chat with your doctor. Supplementation may be warranted. A typical dose would be 400 milligrams of magnesium glycinate about an hour before bed, but your needs may differ, so please check in with your doc. PPIs can also cause problems with calcium. Long-term PPI use is associated with an increased risk of fracture and osteoporosis. Making sure that you get plenty of calcium-rich foods can help to prevent this. Also, once again, chat with your doctor. Calcium supplementation is not a good idea for most people. It can actually lead to an increased risk of cardiac events, and we don't see in the data that calcium supplementation is beneficial for most patients. We just don't see the calcium deposited into the bone, which is where we need it. So, chat with your doc if you are taking a PPI long term. They may want to do something about your calcium, but probably not supplementation. Something else to be on the lookout for if you take a chronic PPI is B12. That can also get depleted. Now, B12 is essential for creating blood cells. So people who are low in B12 will often present with anemia or chronic fatigue. Being low in B12 can also cause tingling in the hands and feet and neuropathy if left unchecked. Having your doctor check on your B12 levels can be super important because if it's really low, you can actually get the intramuscular injection, which will bring up those levels quickly. If it's not as low, you can do oral supplementation. Generally, for my patients, I recommend the sublingual methylcobalamin rather than the cyanocobalamin because it is better absorbed. It kind of gets straight into your bloodstream that way. The next drug class that I want to talk about that can deplete a key vitamin is going to be metformin and other diabetic medications that contain metformin within them, like Janumet. The biggest thing that we see depleted with metformin and those medications that contain metformin is the B12. Now, this is unfortunate because diabetes itself can already cause a bit of neuropathy, a bit of that nerve pain, and then to add in a B12 deficiency on top of that can just be very difficult and painful for those diabetic patients. So once again, get those levels checked. Consider adding in B12. Even if you aren't low, I just recommend to all of my patients who are taking metformin, just add in the B12 as a preventative measure. And honestly, sometimes we'll see patients who get their levels checked and they look like they're normal, but they still have the neuropathy. We add in the B12 and the neuropathy disappears, even though clinically they were already within normal range. So that is something worth discussing with your provider and considering adding to your regimen. Another drug class I want to discuss that many people are completely unaware of is oral contraceptives. They can deplete key B vitamins and also magnesium. In the data, we really see this with the oral contraceptives. Many people ask me immediately, what about the patch? What about Mirena? What about this and that? This is specifically for the oral contraceptives, so the birth control pills. The B vitamins that we see getting depleted with oral contraceptives are B6 and B12. You already know the signs and symptoms of B12 deficiency, look back earlier in this video. But for B6, oftentimes we will see skin issues come up, like dermatitis or maybe even a rash. B6 is also important for the serotonin system, however, so being deficient in it can affect mood and anxiety. So please keep an eye on those if you are taking oral contraceptives, and also the magnesium, which can show up as fatigue, muscle pain, muscle twitching, those things that we discussed earlier. Another drug class I want to discuss that often gets a bad rap that's really unwarranted are the statins, the cholesterol medications. They get a bad rap, I think, because people don't see the incredible benefits that they are doing within our arteries, but they do experience the side effects of like the muscle pain, for example. Adding in a CoQ10 supplement, if you are taking a statin, can absolutely be a game changer. CoQ10 is a powerful antioxidant that can get depleted with statin usage, and taking this alongside the statin can help prevent any of those troublesome issues that people have, so you can get the wonderful benefit of the statin. And I also want to make clear, whenever I say the word statin, people immediately say, oh, but we need cholesterol in our body, statins deplete all this good stuff. And it's 100% true that we definitely need cholesterol in our bodies, but we need cholesterol in our muscles. We don't need it free floating in our arteries, clogging things up and causing major issues with blood flow. And the statins are really good at targeting that cholesterol that's gunking up in our arteries, okay? It's not going to pull the cholesterol out of where it's needed. It's gonna clean up the unnecessary junk that's in the places it shouldn't be. Another important thing is getting the right statin. You want to get rosuvastatin or atorvastatin. Avoiding simvastatin, which is the most closely associated with muscle pain, can be a game changer. So if your doctor has suggested a statin and you're afraid to take it, please don't be afraid, okay? It's an absolutely miraculous drug that can do amazing things. You just don't personally see or feel its benefits, but it's doing great things to help increase your health span and increase your lifespan and make your heart work more effectively, make your cardiovascular system more effective. It can do a lot of wonderful things for you. Just get the right one and take the CoQ10 as long as you don't have a shellfish allergy. So as a pharmacist, I am a big believer in life-changing, wonderful medications, but I do think that they should be used judiciously under the care of a healthcare provider. And I think that things like nutrient depletion need to be talked about more so people don't quit taking these wonderful medications. So I hope this helps, and follow me for more tips from a pharmacist.